Good evening, dear viewers. Welcome to yet another informative episode of BMC Global Live AL-HILAL Health World. I'm Gauri here with you. Before we move on to the talk, please do not forget to like and share our Facebook page. Also like, share and subscribe our YouTube channel. A beautiful face requires a good smile, and a good smile requires the perfect dental care. So to talk more about this, with us today we have Dr. Rinkoo Experienced. He is a specialist orthodontist. He has graduated from JSS Dental College, Mysore, and has done his Masters in Orthodontics from A.B. Shetty Dental College, Mangalore. He is an international member of American Association of Orthodontics and also a fellow of World Federation of Orthodontists. He has made his mark in Bahrain within a short span of 5 years. Hello, doctor. Welcome to the show. Pleased to meet you.
Hi, Gauri. Thank you so much for that wonderful intro. It's a pleasure to be over the show.
Thank you, doctor. How are you feeling today?
I'm doing great. How are you?
I'm feeling fine too. So, doctor, I've heard about a dentist and an orthodontist, but I'm not sure about the difference. So, could you please explain what's the difference between a dentist and an orthodontist?
See, orthodontists are specialists in the field of dentistry who diagnose and treat irregularities of your teeth, face and jaws, and these can include your crooked teeth or spaced out teeth, forwardly placed or backwardly placed teeth, and using a variety of treatment options like braces and a lot of other oral appliances, we correct these conditions.
Okay, so doctor, as you mentioned braces, what exactly are braces?
See, braces are a special device used by orthodontists to move your teeth or straighten them and move them in the right direction to make them look better. So they work by applying a mild continuous pressure on your teeth, which in turn modifies your jawbone, which facilitates the movement of your teeth through the jawbone.
Okay, so doctor, as you mentioned about the braces, so what are the types of braces?
There are different kinds of braces. The first one is the metal braces. So when you hear the term braces, this is what comes to everybody's mind. So they consist of a bracket and a wire, and yes, it's made of metal. The second one is the ceramic braces. They are tooth colored, so they blend in with the tooth and they are less noticeable as compared to the metal braces.
Okay.
The third type is something more advanced in terms of technology. That is the self-ligating braces. So they are much more comfortable to the patient in a way that they apply less force, less pressure, and it has less friction. Okay. So the treatment duration is considerably reduced in complex cases as well. And another type is invisible braces or aligners. Okay, they are completely invisible. They are a set of mouth guard like trays which the patient has to place in their mouth, and every 2 to 3 weeks a new set of tray is given to the patient. So during the course of treatment, there would be a series of 7 to 20 or 30 set of trays depending on the complexity of your malocclusion.
Okay, so doctor, as you had mentioned that we apply pressure on the tooth.
Okay.
So does the braces hurt?
See, this is the number one doubt in everybody's mind.
Yes.
When they hear the word braces, oh, it's painful. See, braces is definitely not painful. A mild degree of discomfort is likely in the initial days. It's the same as you get a new pair of shoes. The first few days you might feel a bit of discomfort, but gradually you get used to it. The same goes with braces. Initially, you might feel a small amount of discomfort, but as your teeth and your surrounding oral structures like your gums and your cheeks get used to it, you are comfortable and it doesn't cause any more pain or discomfort.
So doctor, how do we know if we require an orthodontic treatment?
See, Gauri, there are a lot of problems that commonly occur in our population. The first one being crooked teeth. See, on the left you can see a patient who reported to us with crooked teeth. And on the right you can see them after treatment. The second most common being protruded or forwardly placed teeth. On this picture you can see a patient who reported to us with protruded teeth, and on the right you can see them after treatment. The next most common problem being spaced out or spacing between the teeth, and here you can see after 1 year of treatment how the smile looks. So these are some of the most common problems. Sometimes the front teeth might look normal, but the back teeth might be in a complex malocclusion. And on the other hand, the front teeth might look intimidating and the parents may think that he requires treatment, but it would gradually correct as and when all the set of permanent teeth erupts.
Yeah.
So an orthodontist or a dentist is your best person to go to clear all your doubts and get an opinion.
Okay, doctor. So I've heard that the children who are less than the age of 12 shouldn't go and get an orthodontic treatment. Is that true? What is the particular age to get an orthodontic treatment?
See, the answer to that is definitely no, because in the olden days, people would think that, okay, you need to wait until you're 12 to get braces. But there are more complex malocclusions which can be treated much before the age of 12. If you wait till the age of 12, you might miss out on the growth spurt or a rapid period of growth which lies between the age of 7 to 10.
Okay.
And you might end up in a much complex malocclusion by the age of 12.
Okay.
And yes, fixed braces are placed at the age of 12 because around 11 to 12 is the age when all your permanent teeth are erupted. So that's when you have fixed braces, but there are a variety of other appliances which can be placed much before the age of 12.
Okay. So doctor, if a person is above the age of 29 or 30, like they're adults, is it too late for them to get a braces?
Approximately 30 to 35% of my orthodontic patients are adults. So health, happiness and self-esteem are vitally important no matter what age you are.
Yeah.
So no age is too old to get an orthodontic treatment. So if you have a good gum and overall surrounding bone health, you can get your orthodontic treatment even at the age of 55 to 60.
Okay. So what is the perfect age to get an orthodontic treatment?
As I said, there is no perfect age to get an orthodontic treatment. According to the American Association of Orthodontists, you need to take your child to an orthodontist at least by the age of 7. Because the age of 7 to 10 is a growth phase where rapid growth happens. This is known as a growth spurt. So we can use this growth spurt to our advantage. If a child is lagging behind in the jaw growth, that is his upper jaw might be much ahead and the lower jaw is behind, we can use this growth spurt to stimulate the growth of his lower jaw and restrict the growth of his upper jaw. And this age is also important to rule out any bad habits like mouth breathing or thumb sucking or tongue thrusting, which can have an adverse effect on his dentition. So the age of 7 is the right age to take your child to an orthodontist to rule out any of these habits and also use this growth spurt to our advantage.
So doctor, I've heard about phase 1 and phase 2 treatment. So what is phase 1 and phase 2 treatment in orthodontics?
Phase 1 treatment or interceptive orthodontics is done between the age of 7 to 10 in a moderate or severe or complex case.
Okay.
So when we treat at this age, we can reduce a moderate or severe case into a much simpler one. We can use the growth to our advantage.
Okay.
So phase 1 is done between the age of 7 to 10. The complexity is reduced. And by the age of 12, a phase 2 of a very short duration is done because we had the advantage of the phase 1 treatment and we used the rapid growth to our advantage.
Okay. So when the phase 1 treatment is recommended, can we wait till the child is a bit more older?
This is definitely not recommended because if your child is recommended phase 1 orthodontic treatment, it means that he has a moderate or severe malocclusion.
Okay.
So if no orthodontic treatment is taken now, our options might become limited later on. That is, we might require extractions or jaw surgery if we miss out on the golden period of the growth phase of the phase 1 treatment.
Okay, doctor. So doctor, in orthodontics treatment, is it necessary for the extraction of teeth?
See, every course of orthodontic treatment needs to be tailored to the needs of an individual patient. Extractions might be necessary, be it an adult or a child. Extractions might be necessary in severely crowded cases to fix the crowding or to fix their bite. But these spaces are completely closed, and by the end of treatment, there is no space left out. So extractions can be a part of a treatment plan, but due to the latest advancement in braces, extractions can be avoided in most of the cases these days.
So how will one know if they need an extraction?
See, again, it depends on the complexity of the case. So it can be decided only after a thorough assessment, that is a clinical evaluation and a radiographic or by checking an X-ray by an orthodontist. So only after thorough evaluation we can conclude whether the case needs extraction or it can be treated without an extraction.
Okay. So if a person is wearing braces or retainer, how do they take care of the teeth, and are there any food restrictions?
Yes, we give a complete set of instructions to follow during the course of orthodontic treatment so that the braces are not damaged. So these include, like we ask them to avoid hard foods, like it can include like raw fruits and vegetables like hard apple, carrot, nuts, hard candies or chocolates, the crust of the pizza, or anything very sticky like a chewing gum or sticky candies, etc. So these foods are better avoided to minimize the damage to the braces and reduce the treatment time.
Okay, so how many times should a person brush their teeth when they're having their braces on?
So you need to brush 2 to 3 times in a day for about 3 minutes, and you are also advised to use or like rinse your mouth with a mouthwash 2 to 3 times in a day.
Okay. So how long does it take to complete an orthodontic treatment?
See, on an average, an orthodontic treatment might require anywhere between 18 to 24 months. And this treatment duration again depends on the complexity of the malocclusion.
Okay, so one thing that everybody is very concerned about is finance. So is the treatment costly?
Definitely not, because at AL-HILAL we have affordable orthodontic packages starting from BD 25 per month.
Okay, so if we are moving to a different country, so should we start the orthodontic treatment then?
See, we have many patients coming to us who have started from a different country and they don't follow up after just putting the braces. They think that just by putting the braces, the teeth are going to move or the teeth will go inside. That's wrong, because orthodontic treatment requires care from the very first day until the last day. Every month a follow-up is required. So if you are planning to move to a new country, maybe in a span of 4 to 5 months, I definitely recommend that you start your orthodontic treatment at the place where you are going to be for the next 1.5 to 2 years. According to studies, like people who travel around or people who start at one place and continue at another place, on an average they take at least 6 to 7 months longer than a normal orthodontic patient. And in case you have to travel due to certain unavoidable situation, you need to inform your orthodontist in advance so that he can give you the records like the x-rays and the models, and he can give you a detailed case report. So along with these reports, you can visit an orthodontist at your new destination so that he can continue from there.
Okay, so doctor, finally, are there any take-home messages that we can give to our viewers?
See, there are a lot of myths when it comes to orthodontics. The first one being, is it painful? The second one being, okay, you want orthodontic treatment, remove 4 teeth, put braces, your teeth is going to go inside. So I guess I have answered a couple of these myths. And the next one being, orthodontic treatment is being costly. So orthodontic treatment is not painful. All treatments do not require extraction. It's definitely not costly, and again you need to stick to one orthodontist throughout the treatment, and orthodontic treatment definitely requires follow-up every month throughout the 1.5 to 2 years of the course of treatment.
Okay, thank you so much, doctor, for sharing your time and knowledge here.
It's my pleasure to be over the BMC Health Talk. Thank you for having me over.
So dear viewers, that's it for today. We are going to be winding up this episode. With us today, we had an orthodontist specialist, Dr. Rinkoo Experienced, and I'm Gauri Priya here. We had talked about braces and all those phase 1s and phase 2s of our orthodontic treatment. Thank you all for watching. Please do not forget to like and share our Facebook page. Also like, share and subscribe our YouTube channel.